We're often asked, what are the conditions that affect the prostate gland?
There are three main conditions that affect the prostate. The first is BPH, or enlarged prostate. This affects men as they age. So 50% of the men by the age of 50 have BPH, 60% of men by the age of 60 have BPH, then it's 70% by 70 and 80% by 80. The second condition is prostatitis, which can affect men of any age. This is inflammation of the prostate. And of course, the third condition is prostate cancer.
Rick, patients often ask us, what are the symptoms of BPH or enlargement of the prostate gland?
The symptoms of BPH may include urinary frequency, urgency, having to get there quickly, sometimes urge leakage, leaking before you can't make it to the bathroom, hesitancy or hard time getting started, decreased size and force of stream, positive feeling of incomplete emptying, and getting up at night to void. We're asked questions about prostatitis. Steve, what are the symptoms?
Well, Rick, patients will have frequency, urgency, dysuria, or burning with urination. They oftentimes will have fever or chills with prostatitis. Rick, what are the symptoms of prostate cancer?
Well, sadly, Steve, some men present with prostate cancer with no symptoms at all. So the key thing is to have yearly exams and PSA checks.
What does the American Urologic Association say about screening for prostate cancer?
The new AUA guidelines are out, and they suggest screening for PSA in men ages 55 through 69. If there's a family history of prostate cancer, or if you're black, you should start earlier at ages 40 to 45. What are the drugs we use to treat BPH?
Well, Rick, traditionally we treat enlargement of the prostate gland with alpha blockers. These are medications that will relax the muscles around the prostate gland, making it easier to void. We also use drugs such as ProstaKare and Avodart, which help shrink the size of the prostate gland. We're now finding that several supplements that have saw palmetto and beta-sitosterol in them will help shrink the prostate gland also. How is prostatitis treated?
We often treat prostatitis with antibiotics, but anti-inflammatory medications also have a benefit, and that's why we included quercetin in our product ProstaKare. Are BPH and prostate cancer hereditary?
Enlargement of the prostate gland increases as we age. 50% of men by the time they're 50 years old have prostatic enlargement, and this increases with age. We also know that cancer of the prostate is hereditary. So if you have a family history of prostate cancer, you need to be checked at an earlier age, possibly at 40 to 45. If untreated, what complications may arise from BPH?
For the most part, symptoms may worsen with further decreased size and force of stream. Occasionally, a man will go into urinary retention, requiring a Foley catheter to drain the bladder. ProstaKare may prevent this. How does ProstaKare work?
First of all, ProstaKare is a supplement. It's not a prescription drug. It's made up of four main ingredients. The first two, beta-sitosterol and saw palmetto, both help to shrink the size of the prostate gland. The next one is quercetin. This is an anti-inflammatory to help treat prostatitis. And lastly, we have lycopene. This has been shown in several studies to help prevent prostate cancer.
How often do you take ProstaKare?
We recommend once a day. You can split it into multiple doses, but you may forget one. Where can you buy ProstaKare?
The easiest way to buy ProstaKare is to go to our website, ProstaKare.com. There you can get set up for monthly delivery, and your credit card is charged monthly. Or you can call our toll-free number. That's 855-999-2005. 855-999-2005. And remember, your first month is free, plus shipping and handling. How can ProstaKare help your prostate symptoms?
ProstaKare should help your voiding symptoms. You should see less frequency, less urgency, more complete emptying of your bladder, and getting up less at night. How long do you need to take ProstaKare?
Well, BPH, or enlarged prostate, and prostatitis, inflammation of the prostate, may be chronic conditions. So when you have improvement in your symptoms with ProstaKare, you need to stay on the supplement, just like you would a prescription medication. If you stop ProstaKare, your symptoms will return. Is ProstaKare a natural product?
Yes, all the ingredients in ProstaKare are natural, organic, plant-based for a holistic approach to prostate care. Should you take ProstaKare as a preventative medication?
That's a question you may have to answer yourself, but take a look at the numbers. 50% of men by the age of 50 have BPH. 60% of men by the age of 60 have BPH. then it's 70% by 70 and 80% by 80. Taking ProstaKare may prevent you from having to take prescription medication and may prevent surgical procedures. So if you care about your prostate, take ProstaKare. Where's ProstaKare made and bottled?
ProstaKare is manufactured and bottled in an FDA-certified facility. The facility also is GMP certified for good manufacturing practice. Are there any side effects to ProstaKare?
As with any medication, ProstaKare may have side effects. They are minimal. They may include upset stomach, nausea, vomiting, headache. If you have any serious medical conditions, consult with your physician before beginning any medication. Can you take ProstaKare with other prostate medications?
We're hoping that if you take ProstaKare, you will not need prescription medications. But if you do take these, it's okay to take them together. Rick, people often ask us what our qualifications are.
Well, Steve, neither one of us has played quarterback in the NFL, but we did attend the University of Tennessee in Knoxville as undergraduates, and we did go to medical school in Memphis. I then traveled to the University of California, Davis in Sacramento for 2 years of general surgery and followed this with 4 years of urology at Duke University in Durham, North Carolina.
I did 2 years of surgery at the University of Tennessee in Knoxville and followed this with a residency at Jackson, Mississippi at the University of Mississippi. Together we have 60 years of combined urologic practice. Does diet affect prostate health?
Mark Moyad has written a wonderful book, Promoting Wellness in Prostate Cancer Patients. Chapter 1 is heart healthy equals prostate healthy. So eating a heart healthy diet, maintaining proper weight, exercising, all lead to a healthier heart and a healthier prostate. We have a couple of free resources for patient education.
We are interested in stone disease, and we have a website called stonefreecenter.com. It gives detailed information on the treatment and prevention of stone disease. We also are interested in vasectomy. We have a website called vascenter.com, which gives detailed information on vasectomy as a form of birth control.